Hello, everybody, and welcome to the webinar on the revisions to the Standards of Conduct, Performance and Ethics. We'll just wait a little bit while people are joining. It always takes a few minutes to get everybody in the room. Oh, wonderful. I can see our chat is open. That's great. People saying hello, introducing themselves. Wonderful. So we've got the chat today. We've also got the, we'll also have Slido throughout the session, and we also have the Q&A function open too. So please do use whatever is best for you. We won't be turning on mics or video today. We are recording this session and it will go up on our student hub. So that is the reason why we won't be turning on mics and videos today. But yes, please do use the chat, use the Q&A and Slido when it comes to everything. So good afternoon, everybody. Thank you very much for joining our session today. We're going to be talking about the revisions to the Standards of Conduct, Performance and Ethics. I am Rosemary Flowers-Wangier. I am a policy manager at the HCPC and I've been working on the revisions to the standards. I'm joined today by my colleague Maheshi and I'll let her introduce herself.
Hi everyone, I'm Maheshi De Silva, Policy Officer at the HCPC. I work alongside Rosemary. Really looking forward to today's webinar and all of your contributions too.
Awesome, thanks Maheshi. So today our session is focused on information for students. So I hope you're all ready to get involved and to hear about the revisions that we've made to the Standards of Conduct, Performance and Ethics. As I said, we will be using Slido today. So I just want to give you the information for the Slido chat for when that comes up. So you can join Slido at slido.com. and then enter the number there 3890701. If you've used Slido before, that's great. If you haven't, don't worry. It is really quite simple, but also we also still have the chat and the Q&A if those things suit you better. On our agenda today, we've got an introduction about the standards and about HCPC. And about the review. We'll then be talking about what has changed, the 5 themes to the standards revisions, and also we'll talk about implementation. Firstly, what the HCPC is doing during the implementation phase, and then what registrants and students will be expected to do during the implementation phase. So let's get started with the review, an introduction to our review. So we started the review to the Standards of Conduct, Performance and Ethics in May 2022. And reviews like this are imperative so that we can ensure that these important documents are updated and that they remain relevant to practice. So the Standards of Conduct, Performance and Ethics specifically are an incredibly important document to what we do as a regulator. These standards set out how registrants ought to behave. They outline what the public should expect from health and care professionals, and they help us at the HCPC to make decisions about the character of people who join our register. And we also use them if someone raises a concern about a registrant's practice or when things go wrong. Our review to the standards consisted of a pre-consultation survey and workshops as well with each stakeholder group. From these, along with desk research, discussions with other regulators such as the General Medical Council and the Nursing Midwifery Council, and other stakeholders such as Greener NHS and the Office of the Chief Sustainability Officer, we drafted proposed revisions and released these for public consultation. And we released it for public consultation back in March of this year. We received 218 responses to the consultation, and 190 of those responses were from individuals, 28 responses were from organisations, and of the 190 individual responses, 161, that's 84%, were HCPC registered professionals. So you can see that the public consultation was particularly popular with HCPC registrants, and they recognise that the Standards of Conduct, Performance and Ethics is a particularly important document for them in their practice. We also carried out 6 thematic workshops during the consultation. We had over 200 participants attend these workshops. Following the review, we've made changes to the standards, as I'm sure you can imagine. These changes are not an overhaul of the standards, so several things remain the same. First of all, there are still 10 standards. The headings of these standards remain the same, along with the structure and the purpose of the standards. What has changed is the detail of the standards, and that's what I'm going to go into today. So the revisions that we've made to the Standards of Conduct, Performance and Ethics fit under 5 key themes. And they are equality, diversity and inclusion, communication, duty of candour, upskilling and training, and managing health and disabilities in the workplace. Many of the changes that we've made are about implementing more active language for registrants and making their responsibilities clearer and highlighting the importance of certain values, such as being open and honest and practicing safely and effectively. In addition to these changes, we've also made changes to our guidance on social media that sits alongside the standards. We're also beginning to review the remaining pieces of guidance that sit under the standards, and we're working with our explanatory materials working group to create more explanatory materials for the standards. In response to our consultation question on sustainability, we've committed to creating a sustainable practice hub. I'll go into a little bit more detail about some of these commitments later in the session. Before I do that, let's explore the 5 key themes to the changes that we have made to the standards. So the first theme that we'll explore today is equality, diversity and inclusion. Many of the changes that we've made here are about making the language in our standards clearer and more active. The changes that we have made to Standard 1.3 ensure that service users are better supported by registrants to make informed decisions. Originally, Standard 1.3 read, "You must encourage and help service users where appropriate to maintain their own health and well-being and support them so they can make informed decisions." So you can see the new standard on the slide where we instead refer to empowering and enabling service users. So it's a little bit more specific than encourage and help. Our changes to Standard 1.4 ensure that registrants understand that for consent to be valid, it must be voluntary and informed. And the person consenting must have the capacity to make the decision. Originally, the standard read, "You must make sure that you have consent from service users or another appropriate authority before you provide care, treatment or other services." Now, as you can see on the slide, we refer to valid consent which is voluntary and informed, and we refer to ensuring that service users have capacity to make the decision. The changes that we've made to this section of Standard 1 are all about challenging discrimination. We've added a new Standard 1.5 to retain a simple duty to not discriminate, and we've done that by including a duty to treat people fairly. For Standard 1.6, we've updated the language to make it more active. The changes to Standard 1.6 ensure that registrants are being asked to take action to ensure they are meeting equality, diversity and inclusion commitments. Originally, the standard read, "You must not discriminate against service users, carers or colleagues by allowing your personal views to affect your professional relationships or the care, treatment or other services that you provide." Now, the standard is more specific and it's also more active. It refers to taking action and ensuring that personal values, biases and beliefs do not lead to discrimination or detrimentally impact care. Changes to Standard 1.7 provide registrants with clearer requirements to raise concerns about colleagues whom they think they are discriminating against service users, carers or other colleagues. The standard previously read, "You must challenge colleagues if you think that they have discriminated against or are discriminating against service users, carers and colleagues." The revised standard refers instead to raising concerns and that registrants must follow relevant internal procedures in a registrant's workplace. So it makes it much clearer about what we expect a registrant to do. In this section of Standard 1, which is all about maintaining appropriate boundaries, we've added 4 new standards. Those are 1.8 through to 1.11. So Standard 1.8 introduces active language for registrants to consider the potential impact of their position of power and trust in social and personal settings. Similarly, Standard 1.9 introduces active language around setting professional boundaries, specifically requiring registrants to take action to set these boundaries with service users and/or carers and also colleagues. Standard 1.10 requires registrants to use appropriate methods of communication in their provision of care. And the new Standard 1.11 makes it clear that registrants must ensure that any personal relationships between colleagues should not influence a registrant's professional decisions. Now, Standard 1.12 is an updated standard. It was previously 1.7 and it read, "You must keep your relationships with service users and carers professional." A little too simplistic. The revised standard refers to registrants not abusing their position and sets out a specific set of types of relationship that registrants should ensure are not founded upon an abuse of their power. For example, personal, sexual, emotional, or financial relationships. We have also added reference to colleagues in the standard. As I mentioned earlier, you'll notice that there are some key ways in which this standard, Standard 1, has changed. So there is more active language that is in line with the changes that we've made to the standards of proficiency, and it supports registrants to be autonomous and caring professionals. We've also made changes specifically in response to consultation feedback. For example, following feedback that challenging colleagues, as stated previously in previous standard 1.6, that could actually put registrants at risk of harm. Therefore, we changed the language to refer to raising concerns instead and following appropriate internal procedures. We've also made updates around points of clarity. For example, in our original proposed standard 1.8, we've changed the wording from be aware to consider in the final revision, and that was following consultation feedback. Ooh. Excuse me, I'm just going to my Slido slide now, but it does not appear to want to work. So bear with me a minute. I really want to hear from you, so I'm going to come off quickly just to have a quick look at this and see if we can sort it out. Maheshi, if you wouldn't mind just having a look in the Q&A and in the chat box as well to see if there are any questions coming up.
Yeah, sure. Thanks, Rosemary. And sorry about the tech difficulty. It's bound to happen on a Monday evening, isn't it?
Exactly, exactly.
So,
And so we do actually have a question that that I was going to ask people to think about. So I can tell you that whilst I'm having a look at this. And that was, what might you do to implement these changes into your future practice? So yeah, have a think about
okay,
that, and then yeah, actually just have a look at the chat and the Q&A, and I'll
great.
see if I can
Yeah,
get Slido working.
yeah. I'm not seeing anything just yet in the Slido. I have been able to access it, so I hope all others have been able to access it as well. So we've had in just the Teams chat patient feedback as one of the responses. We're also we've got another comment coming in saying evidence discussions regarding capacity/MCA. Do keep them coming in, everyone. I'm sure will be back up in just a sec, and you should be able to access the Q&A as well alongside the top.
Excellent. I think I've got that up now.
You've got it up
Can
now.
everybody,
Brilliant. Thanks.
Maheshi, can you see the Slido?
Yes, I am able to see
Excellent.
that. Yeah.
So you can see a couple of people typing. So of course you can use the Slido to answer the answer the question that we've got up there. What might you do to implement these changes into your future practice? And you can also put that into the meeting chat or the Q&A, and you can also ask us questions at this point as well.
So I think we've got a few coming in on the Teams chat. Rosemary.
Yeah, so I can see somebody has said patient feedback. That's very important, really good. Yeah, I think it's good to get to, as you go along, to make sure that you've got different mechanisms in which you can get patient feedback. You can hear back from your patients and service users about your practice, and really also make sure you listen to that feedback as well. And got a couple of questions as well. Are we printing any material that we can send out, for example, a leaflet or poster? So what we are doing is we will share the slides with the people who attended today, and we'll also have a video, this recording as well of the webinar up on our website too. Okay, and so let's have a look at our Slido. Another
Yes,
person saying
coming
always
in.
consider patient feedback. Great.
Yeah. I've got another one saying on both the chat and the Slido to implement into staff training, which is really interesting as well.
Yeah, I saw that one as well. I thought that, yeah, it's coming up quite a bit. Staff training, and also we can see here we've got some themes coming up, procedures, informed. So Yeah, so people also talking about making sure that they know the appropriate procedures in their workplace as well.
Yeah.
Very
Yeah,
good. I
also,
love that. Go ahead,
yeah, got it.
Meshi.
Yeah, just another one tying into the staff training, reminders in MDT meetings as well, making sure there's proper procedures to follow and where to find them.
Yeah, awesome. I like this one in the chat as well. Challenging discriminatory behaviour towards colleagues is so important to me, especially from other colleagues. I think that's, yeah, I honestly think that the best workplaces is where people give each other feedback, where someone has said something that's inappropriate. They're given that feedback so that it can be corrected, and also so that your colleague as well, if they have been on the receiving end of discriminatory behaviour, can feel supported. And it's important to have those open workplaces. Awesome. I really love this one as well. Ensure shared decision making and capitalize on using person-centered care principles. That's really great. So, and someone has also asked where the Slido is. Please do check the chat for the information about the Slido. It is Maheshi's just popped it in.
Yeah. We have also got, I think we've got another one just come in. Challenging, inappropriate, or discriminatory behaviour is difficult, especially when there's a power dynamic. For example, students and supervising healthcare professionals.
Exactly, it is, and that's exactly the kind of feedback that we heard during our consultation and our pre-consultation work as well. That actually directly challenging can be really, really hard, and so that's why we've changed that standard to talk about raising concerns. So in the standards of conduct, performance, and ethics as well, there is a section on there are standards specific to raising concerns and how you should go about that and what your responsibility is when you're raising concerns. And I think with challenging discriminatory or inappropriate behaviour, it falls under raising a concern, particularly now with the revised standards as well. And so that should help support registrants and students as well when you do need to raise those concerns and if you are a witness to discriminatory behaviour. Oh, and also I really like this one. This is great. So this person has talked about making sure that they comply with new guidelines, such as raising their awareness of equality, diversity, and inclusion, such as using the wheel of power to help myself to reflect on where my position of power is, and therefore to ensure that I will do my best to ensure that service users are in a more equal power position to me. Really, I think that's really great, and that is the exact kind of that's the exact kind of action that we're referring to when we talk that kind of action where you go out and you find out about different resources that you can use to help make your workplace and your practice a fairer and more equal space for people to be in. Oh, and I love this one as well. I'm going to move on to our next theme after this, but I do just want to say that I really like the idea of giving a talk to other students with the highlights of the changes and updates. Really great. Yeah, do pass on what you've learned today, and pass on the information that we're sharing as well. And feel free to connect people with the resources that we have on the revised standards of conduct, performance and ethics, which we'll go into in a little bit more detail later on. Okay, let's move on to the next theme. And I'm glad as well because a couple of people mentioned their social media. So for example, not using TikTok at work. And this is what we're going to talk about now is communication. Obviously, social media fits under communication, and we have expanded our social media standards. So we will be looking at that in the next slide. On this slide, we're looking at standards 2.4, 2.5, 2.8 and 2.9. And this is all about communicating with colleagues, service users and carers. So under communicate with service users and carers, we have made changes to standard 2.4 to better reflect statutory principles to meet service users and their carers' communication needs. Originally, 2.4 read, you must make sure that where possible, arrangements are made to meet service users and carers' language and communication needs. We now reference taking all practicable steps to meet service user needs. We've also added new standard 2.5. This makes clear that in all communication with service users and carers, registrants must communicate responsibly. Under the work with colleagues section of standard 2, we have added a new standard 2.8. That standard requires registrants to treat colleagues in a professional manner, showing them respect and consideration. We've also added standard 2.9, and similar to 2.5, this new standard states that registrants must use all forms of communication appropriately and responsibly when communicating with colleagues. In other words, it's not where you say something, it's about what you say. And now onto our standards on social media and networking sites. As I said earlier, these have expanded considerably as a result of our review. So standard 2.10 is our previous standard 2.7 on social media. And that standard read, you must use all forms of communication appropriately and responsibly, including social media and networking sites. Instead, the new standard is more specific. It states that registrants must use media sharing networks and social networking sites responsibly. So it's a bit more specific about what we mean when we're talking about social media. We've added two new standards to this section as well, and those standards are 2.11 and 2.12. The new standard 2.11 tackles the increased occurrence of misinformation on social media. It ensures that registrants understand that they have a responsibility to check the accuracy of the information that they share. The new standard 2.12 ensures that registrants' responsibilities to maintain professional boundaries and protect service user information on social media is stated very clearly. Much of our changes about communicating with service users, carers and colleagues originated from stakeholder feedback. So, for example, the concern that survey respondents and workshop participants had about how registrants treat colleagues is represented in new standard 2.8. And we've added reference to standard to colleagues across standard 2. And in standard 2.8, we specifically state how we expect registrants to interact with their colleagues, and that's professionally and respectfully. We also responded to stakeholder concerns about misinformation, and by adding that specific standard intended to tackle that issue. Okay, so we're going to come back to our Slido again. So just a reminder, to use Slido, please go to slido.com. You can then you just enter the number here on the screen at the side, and that is 3890701. We're going to be talking about how might these changes impact how you communicate in your future practice. I can see two people are already typing, which is awesome. Thank you very much. Getting straight on it. And again, just like before, if you want to ask a question as well, or you want to raise any other comment or anything like that, then please do. But do have a think about this specific question as well. And I can see I've got a question in the Q&A, and it says, I just wondered if these changes in today's webinar are different from other changes in the standards of proficiency that came in September 2023. That's a great question. So as we did the review to these standards, the standards of conduct, performance and ethics, we looked at we reflected on our review to the standards of proficiency. The two documents are quite different in terms of their purpose, and so the changes that we've made align across the two documents. So you'll see that we've talked about how we've used active language in the new standards of conduct, performance and ethics, and that is in line with what we did in the standards of proficiency. They do continue to be two separate documents, however, so the wording and things like that is different between the two, but they are both in line and they complement each other.
Got a few more comments coming in on the Slido. Got a comment here saying it highlights my own awareness of the wording of what I can say and not to use jargon, and making sure all consent is clearly obtained. And I think that also is similar to the comment in the Teams chat that we've got, as well as a few earlier comments around appropriate language too, which is key.
Yeah, definitely. And I like this one as well. Make sure you use language clearly, repeat if people can't understand. I think, yeah, being patient with people as well, you know. It's important to do that.
Yeah, and that, I think that ties into another comment as well about having conversations with carers and patients about their preferred means of communication as well. And I think that also lends us to a question on the Teams chat that we've had in, and it's, is there any training you know of that might help neurodivergent people feel more confident that they are communicating respectfully?
Yeah, so I don't know off the top of my head of any specific resources that you could use to do that, but I think it's a great idea to have a look at how you can make your practice, how you can feel confident in your practice as a neurodivergent person. And also what we are doing is in our during our implementation period, I will come on to this later, so I'm not going to give you too much detail now. We're working with a group of people in our working group for designing explanatory materials, and specifically looking at accessibility and how we can we can create resources that go alongside the standards of conduct, performance and ethics revisions to make sure that they are accessible to a wide range of people, including people who are neurodivergent. And I think also the main thing about communicating respectfully as well, if you're not confident, is test it out. Test it out with your peers, and when you enter the register with your colleagues as well, and see what they think. And you know, if you've got a tricky situation that comes up, reflect on it and learn on it. So again, going back to what we talked about earlier about hearing feedback from service users and patients, hear that feedback. If someone feels like that you haven't communicated respectfully, hear that feedback and reflect on it, and then think about how you can adjust that later on, And also, like, we'll come on to this again in a little bit. It's all about when things go wrong as well, isn't it? Sometimes we think that we're doing something and actually we make a mistake. Perhaps we don't communicate in the most respectful way, no matter whether we're neurodivergent or not. And what you do in those situations really matters. And standard 8.1, which we'll come on to in just a little bit, can help you with that and can help you know what we expect you to do in those situations. Okay, going back to the Slido.
Yeah, we've got a few here on social media and taking responsibility of information that I might share on social media, and I need to be more careful and take extra steps before I share online information. And also, you know, social media is a great outreach to the general public, particularly younger generations. However, information must be shared correctly and reviewed before posting on behalf of public health services, as misinformation can damage credibility and patient confidence in the health sector, which is a really, really great reflection.
Yeah, it is definitely. And also I like this as well, talking about making sure content is evidence-based. And that's really important to really think about the information that you're sharing, especially if you're sharing from a professional perspective, and make sure that it's easily communicated to a wide audience as well.
And I think we've got like a common one here of being patient, clear, and concise, and just letting others know that they do have rights and the right to choose and make decisions of their own. That's always important to bear in mind in practice.
It is definitely. And also that other I think the other theme that's coming up is recognizing the rights that service users have, that they have the right to choose. We've got a specific comment here that says to let others know they do have rights, the right to choose and make decisions of their own. And so, yeah, we can see how some of these things really, they tie into each other really. Okay, so I think I'm just going to quickly check the Q&A and then I think we'll move on. Yep,
I think
all
we're
good.
good in the Q&A. Yep.
Okay, let's move on to the next theme, which is duty of candor. So this is what I was talking about, standard 8.1. So if something goes wrong, so for example, you know, there's something that's specific that goes wrong in the care of a service user or patient, or perhaps you've received some feedback that your service user or patient hasn't found you to be communicating respectfully or something like that. Come to this standard, remind yourself of what your responsibilities are under this standard, and yeah, and you'll be golden. So this is, as I said, it's all about what we expect registrants to do when things go wrong. The main thing is to be open and honest. So we have made changes to standard 8.1. And these changes make the processes that registrants must follow clear, and also better align them with HCPC online materials on the duty of candour. We've also added wording to reflect the variety of contexts that registrants work in. So 8.1 asks for example, service users are informed when things go wrong. And you may be in a situation where a service user has left your presence, it's after the fact and you've realised that something has gone wrong, and some of our registrants do not have direct access to service users. So in the instance where registrants do not have direct access to a service user or their carer, they are expected to inform their lead clinician of what has gone wrong. And we have also removed apologising from standard 8.1, and we've set that out as a separate standard, and that's standard 8.2. This new standard 8.2 highlights the centrality of apologising when things go wrong and recognises that apologising is a professional duty. And this better aligns with our guidance as well. So just a reminder for what standard 8.1 originally read as, and that is you must be open and honest when something has gone wrong with the care, treatment or other services that you provide by informing service users, or where appropriate their carers, something has gone wrong, apologising, taking action to put matters right if possible, and making sure that service users or where appropriate their carers receive a full and prompt explanation of what has happened and any likely effects. So you can see the new wording on the slide there that includes the reference to informing a lead clinician, and it also includes that new standard 8.2 and the removal of an apology to that standard 8.2. So the changes that we have made to this standard mostly originated from stakeholder feedback. That includes to make standard 8.1 clearer and also to better align the standard with our online materials. We also heard from some registrants that they would not have direct access to service users and carers in order to contact them, and that a standard requiring them to inform service users or carers would be difficult to meet. And as I said, that is why we added reference to a lead clinician in standard 8.1. And I do just want to highlight here as well that we have had a couple of questions so far when we've done these workshops about apologising, and people recognise a lot that apologising is really important, but also a little bit concerned about their liability if they do apologise. And just to say from the outset that apologising in the UK does not legally admit any liability for what has gone wrong. It is simply apologising. Okay, so coming to the chat and the Slido and the Q&A, however you want to engage, we've got a question here that is, how might you apply these changes to your future practice? So give that a think. Including like, how do we apologise? How best do we apologise? What situations might it be a bit difficult to apologise? I can see people are typing away, so I'll give you a chance to put your thoughts down and share them. And just a reminder as well, if you're struggling to get onto Slido, it is you can join at slido.com, and the number that you need to input is 3890701. But of course, if Slido is challenging for you or you just don't like it, we've got the chat function and also the Q&A that you can use as well. Also, so the first thing we've got coming through is to record everything that happens along your notes. It's a very good idea. Actually, what were you going to say?
Yeah, I've just pinned the Slido as well, so it's there for access. But we've also had a comment coming on the Teams chat, and it is exploring in supervision before and or after making that apology. So having backup support from the team.
Yeah, that's great. I think that's really important, and that can really give you confidence, can't it, to apologise, and do so just in the best way possible, really. And someone else here talking about sort of having confidence. Somebody talks about maybe finding out if your trust has a framework or guidance on apologising so that you feel less unsure or worried about saying the wrong thing. I like that. That's great.
Also got another one, avoiding blame culture. So and that also ties in with a Slido comment we've got. So when something goes wrong, that initial worry can really cloud your judgment and what you do next. So being able to ground yourself in that moment and keep your duty of candor front and center in mind is essential.
Definitely. And I think that really goes with these standards, with all of these standards, the more you read them, the more you become familiar with them, the more you can really keep them in your mind and help them to ground your practice. Yeah, and I love this one as well. Being more open and honest. We are humans at the end of the day and we make mistakes. The first thing I would do is apologize. So I'm happy that it has been made a standard. Yeah, and yeah, like I said, it's not admitting liability. It really does make such a difference to service users and patients when health and care professionals apologise. And we really heard that feedback, particularly from our focus group with service users and our patient focus group. Yeah, and I think this one is important as well. Someone's mentioned remedying the mistakes as much as possible. And I think that's such an important part of duty of candor. It's reflecting upon what has happened. It's not just about being honest and open, it's also an opportunity for you to reflect on what has gone wrong and the things that have led to that and what you can do to correct it as well. And then also that means that in future hopefully that thing won't go wrong again.
Yeah, and we've also got another one with the apologizing as well. Apologize with sincerity. It just shows that human genuine care, and it's a commitment to learn from it as well, which I think is really important. And also on this as well, on the Slido, we've got a comment saying to document, date, and sign all incidents and record if you apologized, as it's often fed back, which I think it's great. It's good to do as well. And this person said, I also like to keep emails to be able to track what happened when looking back on things, as you often forget or build a different picture of the incident. So it's important to really realize we're all human and mistakes
Yeah,
happen and we care. So therefore we learn.
definitely. That's great. And I think I like that, like reflecting upon what that person has just said as well, is like building a different picture of what has happened. And sometimes we can get into situations where someone thinks we should apologize and we just don't see it that way. Someone thinks that we haven't communicated respectfully, or someone thinks something has gone wrong, but it hasn't. And it's about understanding that people view things differently and respecting their point of view and their experience as well. So not being too not holding on to your own view of the situation so much. And also, I think someone else has said something very important here, which is debriefing. Discuss with the team the need and way and who should talk to the patient or service user and their carer to apologise. And I think that really speaks to how important it is to where you do have a team, you draw upon that support as well, and you take that reflection to the team so that you're all reflecting together and building up that plan together as well. You're much more likely to come up with an effective apology and remedy to the situation.
Definitely. And I've seen a comment that's I think it really stands out as well, just training as well on how to have difficult conversations and apologizing as part of staff training. I think it's important to have that implemented. It may seem simple, but it could definitely make a big change there.
Exactly. And that is the perfect point, because I'm next, I believe, going to go on to training, upskilling and training responsibilities. What a wonderful way to lead me on to that. Thank you very much to that person and Mehershi for pointing that out as well. So the changes that we have made regarding upskilling and training responsibilities, these relate to standard 3 and specifically scope of practice. So the changes that we've made to Standard 3.1 make the relationship between safe and effective practice and scope of practice clearer. Originally, the standard read, you must keep within your scope of practice by only practicing in the areas you have appropriate knowledge, skills and experience for. The standard now includes specific reference to safely and effectively. We added a new standard, and that's standard 3.2, to ensure that registrants understand the actions that they can take to widen their scope of practice. This standard references undertaking additional training to update one's knowledge, skills and experience. Standard 3.2 is updated from previous wording. You must refer a service user to another practitioner if the care, treatment or other services they need are beyond your scope of practice. And we've expanded this standard to ascertain that this person must hold the appropriate knowledge, skills and experience to meet the needs of the service user safely and effectively. It thereby specifically sets out that they must hold the appropriate scope of practice to provide the service being referred. So the changes that we made relating to upskilling and training, mostly related to scope of practice, our registrants often ask questions about scope of practice, and quite often they're asking what they need to do to widen their scope of practice. I think since COVID-19, a lot of health and care professionals have been asked to do tasks that they weren't previously asked to do and that may sit outside their scope of practice. And so we've got a lot of questions about how one widens their scope of practice. And that really is about gaining the knowledge, skills and experience to carry out the task at hand. And without that knowledge, skills and experience to carry out a task, you should not be carrying that task out. The changes we made also set out to make this, so they make this clear and to help registrants understand that what is central to their scope of practice is safety and effectiveness of their care. Okay, so we're going to come back to the Slido. I'd love to hear your thoughts on this and how might these changes impact your future practice? So again, we've got the Slido available, which I think people are enjoying using, which is great. Don't forget the number is 3890701. And yeah, you just need to go to slido.com to pop that in. We do have the chat and the Q&A function still available as well. Right, the first comment that's come through is making sure I keep abreast of new developments. And I mean, you're doing it right now, so that's great. Yeah, you're hearing about our revisions to standards of conduct, performance and ethics. These standards were published back in October, so not too long ago. And yeah, we are just at the beginning of our implementation phase. So you really are in the right place to understand these standards, hear more about them, and to see how they'll impact your practice as well. Oh, this is a great question, and I love it because it goes direct to a document that we've created. So someone has asked, in terms of tracking new developments, is there anywhere we can see the old and new changes? So yes, if you go to the revised standard section of our website, and Mahesh, I'm going to ask you to pop that into the chat if that's all right. You will find a number of different documents, and I will come on to those a little bit later. I'll go through them a little bit, but there is a document there specifically talking about that has the old standards and the new and what has actually changed against them. So great question, thank you. Love this as well. Different methods of continued professional development, workshops, webinars, journal clubs, conferences, journal clubs. I don't know what journal clubs are, but they sound great.
We've also got in the Teams chat, it will help us advocate for maintaining OT roles in dual roles.
Definitely.
And also ties into a Slido comment for request training in the areas that we need improvement or new equipment in the department.
Definitely. And you can use these standards to actually advocate for yourself in that regard. So, you know, these standards really do set out that you cannot practice outside of your scope of practice. You can't practice somewhere where you do not have the knowledge, skills, and experience. And that means that if someone's asking you to do something outside your knowledge, skills, and experience, find the training that you need, take the standards with you if you need to, and say, well, this is the training that I need. The standards say that I need to do this training in order to do that task. So there you go. Help me carry out the training. And also, I've missed it now, but someone also said being comfortable with saying no as well to if you aren't appropriately trained in the task that you've been given, and then to receive and then to ask for additional training if somebody continues to ask you to carry out those tasks. And again, in those situations, you can use these standards, refer to your standards. You can just say standard 3, it says I cannot do that. If I do that task and I don't have the skills, experience, and knowledge to do that task, then I could lose my registration. So no.
Yeah, definitely. Got another one here on seeking out new learning from colleagues and shadowing in new areas where developed. And that, I guess that ties into an earlier comment on Slido as well about not being aware is not good enough. So actually making those steps forward to making sure your training competencies are up to date is important. So that recognition and I think that reflection is really good.
It really is, definitely. We've got a question here as well about how Standard 3.1 relates to students on placement in departments they have never been in. Or rotational job, for example, an OT can work in stroke, rheumatology, mental health, etc. So I think what's important to remember when you're a student is you are there to learn. You're there, this is an opportunity to gain the experience, knowledge, and the skills that you need. And it's to draw upon the knowledge that you've received in your training so far. It's to put that into practice. And I think if you're in a situation where you're being asked to do something that you do not know how to do, don't do it. If you're in a situation where you're being asked to do something that you have knowledge of, but you've not got the experience, you're not sure about your skills, ask someone to help you. And you know, you should have supervision in those instances. And that, like I said, it is it's an opportunity to build upon your experience, but you shouldn't be left in a situation where you're completing those tasks on your own without having the knowledge, skills, and experience to do so. Oh, this is really helpful. So someone has said using RCOT 4 pillars of practice will help you identify current level of practice and areas of strengths and weaknesses. So that's in the Teams chat if anybody wants to have a look at that, the RCOT 4 pillars of practice. Thank you to the person who put that in the chat, really helpful. Proactively engage in workshops, conferences, and exchange knowledge, experience, and skills. That's really great as well. That's exactly what you all are doing here. You're all very engaged, and I also love the sharing of knowledge, like we just talked about, that person referring to the RCOT 4 pillars of practice.
Yeah, and I think the another comment as well about understanding my scope of practice will help me provide the best service and develop new skills in terms of knowing the right arrangements that should be taken in critical situations. So another reflective comment there. And I think that also ties into kind of another comment about educators making sure they offer relevant experience to students and allowing them an appropriate amount of independence.
Definitely, and you'll be glad to hear as well that talking about educators, we have been specifically working with education providers to talk to them about the revised standards of conduct, performance, and ethics. And they were actually one of the first groups in which we hosted a workshop for on the revised standards, and we'll be continuing to talk to them throughout our implementation period. They are one of our main identified stakeholder groups alongside yourselves as students, and registrants and everybody else as well. So. Okie dokie, so let's move on to the next theme, which is managing existing health conditions and disabilities in the workplace. So here we have added a new standard 6.3 to make it clear that a registrant's responsibilities are to actively assess the impact that their health has on their practice. Following consultation, we added or asking an appropriate health and care professional to assess to standard 6.3. We've also added that in the circumstance that a registrant is unsure of their ability to make an assessment themselves, they should refer to another health and care practitioner to make a health assessment on their behalf. So that's what or asking an appropriate health and care professional to assess is all about. Standard 6.4 is updated, and previously it read, you must make changes to how you practice or stop practicing if your physical or mental health may affect your performance or judgment or put others at risk for any other reason. So we have changed that standard to specifically refer to detrimentally impacting your ability to practice safely and effectively. And also setting out that a registrant is responsible for ensuring adjustments are made to their practice to make it safe and effective. So again, coming back to that centrality of safe and effective practice. The new standard also makes clear that if one's physical or mental health detrimentally impacts their practice and it's not possible to make adjustments, they must stop practicing. So we made these changes following feedback from some of our disabled registrants that the previous standard 6.3 could make their registration more laborious and create confusion about when they should refer themselves to the HCPC. In response to concern about registrant ability to assess their own health as well, we made the addition to standard 6.3 that a registrant can refer to another health and care professional if they're unsure about their ability to make an assessment of their own. Okay, coming on to our next question. So, how might you manage your health and well-being when you enter your profession? You can see people getting straight to typing. So I think what's important about this standard is to remember this is where we talk about stopping practicing, that is specifically where adjustments are not possible. So again, you can use these standards as an advocating tool to request adjustments, request reasonable adjustments in your workplace and things like that as well. And I think this is exactly where the some of the comments that are already coming in are saying, so that you've got someone saying letting your supervisor know about your extra needs, being honest where you need help and communicating that to your team.
Got another great one of ensuring I take breaks so as not to burn out and utilizing the wellbeing support offered by my trust.
Definitely. And another one, similar, effective debriefing is essential, especially with regards to mental well-being. That's really true, especially if a situation has been tricky, if it's been a very busy night or day. Yeah, I think it's important to be able to have those moments to share. Love this as well, taking all the relevant steps to ensure that you're not pushing yourself too hard or spreading yourself too thin. Prioritize. Otherwise, you may not be able to do enough correctly. Place value on your mental health too, and be honest with colleagues.
Yes.
Yeah, I think this is another one as well. Being timely. So do not be afraid to share earlier on in your difficulties. I think that's so important. Don't let it get to a point where, you've been struggling on your own for a while. Really, there's no reason to struggle on your own. You're not alone. You have your colleagues, you have your peers, your managers. Try to use those resources to help you.
Love the comment on the Slido about having healthy nutrition, exercise, and good or positive people around me, which is always important.
Definitely. Sometimes like that is really, especially like positive people, like having someone around who makes you feel comfortable can really make such a difference to your day. So I think that's the other thing as well about when you're thinking about sharing, share with those people who make you feel comfortable as well.
Definitely. And another comment about, don't feel like you'll be judged for having additional needs and take support where provided. So I think that also ties into the earlier comments as well about leaning on your trust's kind of well-being support and activities
Definitely.
offered.
Yeah, exactly. And something that can help with that as well, someone's mentioned on the Slido, having a good mentor. Don't don't be afraid to ask questions. So yeah, when you enter your profession, don't be afraid to ask questions about how things work, about where you can get support for your well-being and things like that. Don't be afraid to ask, is this feeling I'm having normal? Is this what a normal day is really like? Understand that a reasonable adjustment to your practice does not mean you're not capable. That is so true. Reasonable adjustments, I think, are really all about making the space work for you, making your workplace work for you. And I think that's really incredibly important because realistically, it all comes down to being able to practice in a safe and effective way. And your workplace should always enable you to do that.
Got a really good comment that's just come in, and it's about kind of being open about feeling overwhelmed and not worrying about how it may be perceived. And don't delay that because it's just too busy right now, because chances are it's always going to be too busy or not a good time. So being honest with yourself and not being worried to express it is important. And getting a good night's sleep, which is another comment.
Definitely. Sometimes having a good night's sleep just makes all the difference. I like this as well, linking back to the standards around challenging discrimination. Following this helps with making sure the workplace is somewhere colleagues feel they can share their additional needs. It's very, very true. And I like that as well because it talks about how all these standards link together. And that's why it's important to familiarize yourselves with the whole of the standards as well, and really think about how they intersect and what your responsibilities are as well. Because at the end of the day, there may be a colleague that would really appreciate you, you know, you making that space safe and effective so that they can talk about how they're feeling and talk about the needs that they have. Seek advice from colleagues about work-life balance, fighting against procrastination and self-management skills. Yeah. Chances are there's a colleague that has been through whatever you're going through, and who can give you some tips as well. Oh, I think this is a great one as well. Set goals and priorities. Always remind yourself that service users need the best of you. That is really what it comes down to. I mean, HCPC's core objective is protection of the public, and that's what it's all about. All these standards, it really is about making sure that your practice is safe and effective for service users. Okie dokie, we're going to move on to the next slide. So next, I'm going to talk a little bit about sustainability. This is an area that we discussed in our consultation. We haven't added a new standard on sustainability or made any specific changes to the standards that relate to practicing sustainably. However, we have committed to reviewing sustainability as part of our standards of education and training review in 2024. And we will also be creating an area of the HCPC website that discusses practicing sustainably, and that will be our Sustainable Practice Hub. And we're doing this because we included sustainability as part of our consultation, and we heard back from a number of consultation respondents that sustainability was important to them. And our registrants, particularly, some of them are worried about us introducing a standard on sustainability. It might be difficult to implement, especially in low resourced workplaces or workplaces where it's hard to actually make the sort of big decisions about how you practice individually. And also we had some people who just didn't really know what sustainability was and how it related to health and care. Overall, the responses that we received about sustainability were incredibly positive, and people did really want to practice in a more sustainable way. And so what we hope is that the Green Practice Hub will offer resources for those who want to understand sustainability more and how it relates to health and care. And it will also support those who want to practice in a more sustainable way as well, about thinking about providing resources on how they can practice in a more sustainable way. Okay, so another question here. What will you use the Sustainable Practice Hub for? So this is quite helpful to know, especially now that we're in the development stages of creating the Sustainable Practice Hub, because then we can see what people want to see on it, how people want to use it, and yeah, we can use this to feed into that. Not sure yet, I need to explore this area. That's no problem. Maybe when the Sustainable Practice Hub, you can look it up and it will help you understand this area a bit more. Got a comment in the chat saying ideas for best sustainable practice.
I've also got another comment saying I think it could be a good place for people to unite to put pressure on providers to reduce packaging, for instance, and ideas and guidance on making sustainable changes in my workplace.
This is an interesting as well. Mapping my skills and practices to the new standard skills audit with links to further training would be great. So that's a really good point, actually, and we do have that for our standard of proficiency. We have a gap analysis tool for the new standards of proficiency that came into effect in September this year. And yeah, so we can have a think about that as well, about what kind of skills audit links we can have on the website in general. So here's some ideas of practicing sustainably as well. Avoid printing unnecessary paper-based documents. Yeah, so someone's written a kind of knowledge base which can be shared amongst the practice and even across the country. Therefore, we can reduce the need to develop different individual platforms. I think that's really important because there is a lot of information about sustainability out there. And I think part of the Green Practice Hub will be collating the resources that already exist, and so that registrants and students as well can find those resources easily.
We've got a comment in the chat on increasing IT skills to support paperless working, which I think ties into a lot of other comments as well on the Slido.
Yeah, it does, definitely.
Someone's also written a kind of knowledge base which can be shared amongst practice and even across the country. Therefore, we can reduce the need to develop different individual platforms, which it's also, yeah, great comment.
Yeah, and also discussing strategies to improve sustainability that are actually practical and can be widely implemented. So yeah, I think once you have resources on practicing sustainably, and one can actually share those with the rest of your team, you can use them to start conversations. Not all things might be possible for you in your workplace, but it doesn't necessarily mean that it's not worth starting a conversation about how you can move towards making it possible. Okay, so I'm going to move on to the next question because we've only got just over 10 minutes left, and I want to hand over to Maheshi to go through our implementation slides.
Great, thanks, Rosemary. So as we move into the final few slides, so our implementation period, the standards of conduct, performance and ethics, comes into effect in September 2024. So up until that point, that's the period of time that we're calling our implementation period. So for us, our implementation period is all about ensuring that all of our stakeholders really understand the revisions to the standards and that they know their obligations to implement them as well. So we will therefore be carrying out a range of training activities through workshops with our external and internal stakeholders. We will also be reviewing the guidance that sits along the standards, such as our guidance on confidentiality and the online materials that explain the standards. And we will be developing explanatory materials to ensure the standards are accessible to a range of different readers. So our first round of external workshops are taking place in November. Please do visit the HCPC website to sign up, and please encourage others as well who may be interested to join in too. So I think we may have another opportunity for you all to ask some final questions before we wrap up. Don't think we've got anything in the Q&A. I think I could see some people typing on the Slido, which is great. You'll just give them a few seconds.
So yeah, if you have any questions about implementation period, what we'll be doing, things that are on offer, do just let us know. And yeah, what's worth noting is that we do have, so obviously like our workshops, this is the second of our public workshops. And we've got another one, can't quite remember the date, it was on the previous slide. We've got another one that's specifically aimed at employers.
The 21st of November, got it.
Thank you.
Yeah.
And then we'll also be doing other workshops as well in 2024, and those workshops will be thematic. They'll be public workshops, specifically looking at the 5 key themes to the changes that we have made.
You've got a question.
Yeah, this is I think a question about the standards of proficiency changes. And whether there are any workshops available that cover those new revisions. And yes, there are many workshops available, and I'll pop those into the chat so that you can find them. We've got a lot of recorded webinars that took place over the past year or so, I think. So I've got a question in the Slido that's really quite specific, and I'm going to refer you on to our policy inbox so that we can chat to you about that question. So it's, if one is referred to professional suitability panel hearing at the university and he/she has been given an occupational therapy assistant role at the same time, should he/she disclose this information to the trust? Yeah, so it's a bit specific for us to answer here. So please do, the details of the policy inbox are coming up on a couple of slides in a couple of slides time. So yeah, do pop that question over to us and we can do our best to answer it there. Another question, how are you engaging educators to ensure pre-registration programs produce students who meet the new standards? So we have been talking to education providers already. We did a workshop with them in the first week that we published these standards. They have also been involved throughout the review period, so since May 2022 when this review started. And we'll be continuing to engage with them as well through regular updates and workshops as well to discuss their progress and things like that. I think we've got a couple of slides to go. So
yes, so just on that last question on the Teams chat, what steps do we need to take next as registrants? And I think that lends us onto the last few slides now. So I'll just give you a few moments so we can change screen onto the slide deck. Great, thank you, Rosemary. So to continue where we left on implementation and what registrants need to do. So during this implementation phase, we also expect registrants to be preparing themselves so that when the standards do come into effect on the 1st of September 2024, registrants are able to kind of apply those standards. And that includes anyone who's entering the register for the first time. We also expect those new registrants to undertake CPD and develop their skills and knowledge on the new standards. We also have a number of workshops and resources that registrants can engage with to prepare themselves. But here are just some of the documents which you will be able to see on screen now. So we have some available on our website on the revised standards. There was a link also posted a little bit earlier, which I will post again into the chat, where we have information on how those changes were made, and especially our consultation outcome document of what we heard and the different decisions that were made from this. We also have the equality impact assessment, which can also be found online. There is also a main news story which provides a summary of the review and the key changes on the document. So it's really helpful to understand those changes as well. And it also lists those changes against the previous standards. So if there are any kind of last opportunity questions for anyone, please do let us know on our Slido now. I think we do have, yes, one more opportunity for you all to ask. I think we've got a few in the chat, haven't we, Rosemary?
Yeah, we do have a few questions in the chat. I've just to let you know, I've put the revisions to the standards of proficiency in the chat as well, relating to the question that we had earlier on about where to find out about those changes, and also view some workshops and webinars that we did.
Great, thank you.
So we've got a question asking, will we receive printed copies of the new standards? We aren't printing new copies of the standards. You can request copies in, for example, in Welsh and also in large print as well. We will be updating the sort of explanatory materials that go alongside the standards. So, for example, an easy read version and things like that. Those will be published within the implementation period before September 2024. So watch this space.
I'll check the Q&A as well, see if we've got anything in there.
I see a couple of people typing in the Slido.
Great. And you will also have an opportunity to contact us via email as well, which we'll go through in just a little bit. I think we've had a question come in.
So in relation to how you can add the webinars that you've attended to your CPD profile, we don't ask for any evidence of you having attended webinars. You just need to literally add them to your CPD profile, but there's no need to evidence them. So whilst we are very happy to provide certificates if you'd like, we don't require you to show us any certification that you have attended. Any possible case studies where each revision applies? So I'll take that forward into our discussions with our explanatory materials design group. So we are talking about what different materials people might need to understand these revisions, to understand the standards, and to apply the standards to their practice better as well. Got another question, how HCPC can protect their members from allegations made from other colleagues with the danger to raise concerns against them that affects his or her conditions of practice. So we're quite clear in our standards of the behaviours that we expect registrants to meet, and where a concern is raised, we do review those alongside the standards and the guidance that we have as well. So as I said earlier about the purpose of these standards, one of the reasons we have these standards is to enable us to refer to them when someone has raised a concern about your practice. I think the main thing that you can do is to know your standards well, and to put them into practice. Reflect on how you can apply your standards and keep in contact with the HCPC and the updates that we do to our standards as well. And also to the material that we release regarding how you can better apply these standards. And yeah, thank you so much to everybody just saying
Thanks.
thank you. We're so glad that you have enjoyed the presentation. Yeah, Maheshi, did you want to go back to,
Yes, sure. Thank you, everyone. And I hope that answers everyone's questions. Slides and recording of today's webinar as well will be sent out to all attendees. But just before we go, I've got a few contact emails here and some social media links for you all. And you could also talk to our professional liaison team, our policy department, registration, and our fitness to practice. So you'll see all the emails on screen now. And don't forget to kind of give us a follow on Twitter, LinkedIn, Facebook, YouTube, as we have all of the updates and events, and we always publish those things on there. So it's a good way to kind of stay involved and updated as well with what's going on. So I think that brings us to an end. I hope you all go and enjoy your evenings. Thank you so much for joining us today on your Monday. And thank you all for your contributions.
yes, definitely. Thank you, everybody. And yeah, it has really been a pleasure to have you all here and to hear your engagement as well, your thoughts on the questions that we've been asking. And as I said, if you have further questions and things like that, you can, as Meshi said, you can reach us at the policy email address, and I will pop that into the